Hello, hello, hello. Thank you everyone for joining us for another episode of Ask Miss Jai Live. I'm so excited to be here today and to be doing an interview with a member of our community. So stick around and learn more about all of the bits and pieces of aerophysical therapy and pelvic floor health. And I will get into that in just a moment. If you're catching this on the replay, go ahead and put a hashtag replay in the comments. Let us know what pieces of our conversation you found most interesting, what you would like to learn more about. We love to hear the feedback and love to hear comments on those. My name is Miss Jai. I use she, her, and he, him pronouns, and I am the host of Ask Miss Jai Live. This is a pre-recorded discussion that we are going to be sharing today, but no less exciting for us to be putting it forward. So with that, I'm going to go ahead and introduce our guests for today. Sam Arrow, they, them, theirs, is the founder of Arrow Physical Therapy. They started their practice after many years of working in outpatient clinics and being frustrated with limitations on the type of care they could provide. And eventually, when they realized their own queerness, they became frustrated with environments that did not support queer therapists or patients. Sam loves being a pelvic floor physical therapist and especially loves being the therapist that makes you feel seen while helping you figure out what works for you and your body. Sam studied dance and graduated from the University of Arizona with a BFA in dance and continues to be involved in the dance community in Phoenix. They earned a doctorate in physical therapy at the Arizona School of Health Sciences and have been treating pelvic floor dysfunction since 2010. They have special interest in treating trans, non-binary, intersex, and gender expansive individuals of all ages and in treating children with disabilities, especially neurodivergence. They really love getting to know people and finding ways to make them feel better. They live in Central Phoenix with their partner, children, and pets. And they are also a dance artist and permanent artist in residence with Newbox. And on a personal note, I know Sam through a fantastic queer professional coalition. And so I'm so excited that we get a chance to sit down and have a conversation in this setting. So thank you so much for being here today, Sam.
Yeah, thank you too, Miss Jai. I'm really excited to do this today.
Awesome.
I'm ready for it.
Well, wonderful. Well, could you tell us a little bit about your journey from working in outpatient clinics to starting your own practice, Aero Physical Therapy?
Yeah, absolutely. I started working out in outpatient clinics doing primarily pelvic health. I also did like orthopedic stuff too. So I saw a wide range of patients, but I was really frustrated with there was always a threat of like looming shortening treatment times based on the reimbursement rates we would get through insurance. Just the reimbursement rates are decreasing over time, and that's like continuing to happen. I require 1 hour sessions with my patients because it's a super intimate, you know, treatment that we do, and it requires extra time for people to like decompress when they get into the space. I need to be able to check in with them, and I need to make sure that people feel safe. And if I don't have that hour treatment time, then it's really difficult. People aren't just like ready to go with pelvic floor physical therapy if I get a 30-minute or a 45-minute treatment slot, for the most part. So that was very stressful. And then to have someone dictating like what kinds of treatments you can do and bill for, because of those reimbursement rates, those things are, it's hard to fight against that when your patient really needs something else. So those are, some of just the logistical things. And then of course I have worked in environments where I had supervisors that made, sexist comments, and I have been called derogatory names, based on like my queerness, and not feeling like you really have anyone to go to because I'm the only pelvic floor physical therapist, in that clinic. And that if you complain, everyone's going to know. So I had experiences like that. And I think that the second I got out of that environment, even though it's really scary to go off and do something on your own, I felt a lot of like relief and like, like the pressure is lifted, as I like transitioned out of that. So yeah, I think that the freedom that I get working for myself based on like being able to just be a physical therapist and do what I do best and help people in the ways that like works best for them. And then also getting to be myself. That's super freeing. I really didn't feel like I could be as like authentic in my queerness without leaving those environments, because they did, even though maybe there aren't direct policies against being who you are, um, you know people's behavior, the way that people receive you, it really affects how comfortable you feel. So um, yeah, it's been a dramatic improvement in my mental health for sure.
I'm glad to hear it's an improvement. It's not easy to be an entrepreneur and start your own practice as well. So I'm glad that you're in our community and that you're doing this work.
Thank you.
How has your background in dance, because so much of what you shared with me and what I know and how we've discussed before is that dance is a really important part of your life. How has your background in dance influenced your approach to physical therapy and treating the pelvic floor?
Um, I love that question. I danced since I was very young, like 8 years old, and then of course, like continuing to do it, and I still do today. I've had some like really fun ways where I've been able to combine what I do for physical therapy and for pelvic health, and then also my dance. Um, like experiences. So I have created some like movement based classes that incorporate like things for pelvic health and also like some, they're not specifically dance movements, but I have been able to like kind of enmesh those two things. So I do a pelvic awareness class that like people could just go and take, and they can improve their pelvic floor awareness. They improve like mobility in their abdomen, in their low back, in their hips, in their pelvis, and all of these things can help pelvic health in general. Um, they can help with like good blood flow to the area that helps with like orgasms, and if you had like pain or inflammation in your abdomen, like these things can also be improved. You get fluids moving, and you know, there's just a lot of different benefits to it. So I really like whenever I get the chance to like kind of combine those two worlds. And if I ever, because I teach dance sometimes, and so if I do, I always incorporate a little bit of something for pelvic health in my dance. And then when I work with people, as a physical therapist, I will sometimes draw on some things that I learned as a dancer. Um, Specifically, like I can think of, there's like a cranial sacral rocking technique that I learned in college at the U of A, and it's really good for like nervous system regulation, specifically thinking about like our vagus nerve. Um, so I will have patients do that because, if people come into a physical therapy appointment and they are, if they're dysregulated, they're in chronic pain, sometimes you need to do other things to kind of um, get your nervous system to decompress or, down regulate so you can make progress in physical therapy. I can't just like, just work on people and just think about their pelvic floor. You're going to miss things because obviously people are like entire like complex beings. um, so you have to, I hope all physical therapists do this, is they draw from other areas of their life so that they can try and meet their people that they're working with like where they're at.
Yeah, I'm sitting here thinking about for myself as well. I sit at a computer, I sit in a desk chair for
Mhm.
5 to 8 hours a day, and I just think about all of the ways that pain can manifest in the body and how move like even just movement and some of the things that you're sharing can be so powerful in helping our bodies heal a little bit as
Mhm.
well.
Yeah, absolutely.
Yeah. You had mentioned also in your bio that you work with folks of all ages, but especially
Mhm.
work with folks who are neurodivergent and who have disabilities. And I'm wondering, how has your experience of treating clients who have a disability or who are neurodivergent influenced the care that you provide to gender expansive clients and vice versa?
Yeah, actually, this actually might be my favorite question because I have quite a bit of neurodivergence like in my family, and I kind of, I live in that world, um, which I love it. But you tend to notice that there are patterns. And when I am working with people as a physical therapist, of course, a lot of those people are queer. And then you will start to notice that those people might also have some neurodivergence. I mean, it's not everyone, right? But if we're just talking about patterns, then you also might start to notice that they have like maybe some connective tissue dysfunction, like they are hypermobile, their joints move too much, or they're, people talk about being like double jointed. Um, and on top of that, they might also talk about having, there's like a collection of like syndromes, I guess, that tend to occur together. So there's like this Venn diagram of neurodivergence and hypermobility, and there's a disorder called POTS, postural orthostatic tachycardia syndrome, which is basically if you stand up and you get lightheaded and you might pass out. It's a blood pressure and like heart rate regulatory issue.
Hmm.
Um, that people tend to have that, and then they'll also have another issue called MCAS, which is mast cell activation syndrome. Like the fact that I have a lot of like exposure to people who are neurodivergent, and then knowing that these things are comorbid with it is really important, because I can't tell you how many times in the past couple years that I have actually told people about these like co-occurring issues, and then like the light bulb goes off and they think, oh my gosh, this is exactly what I'm experiencing, and I just help them like self-diagnose something else because of like my exposure to these things. And then they have the avenues that they can go down if they need additional help. Then I can help them find someone like another doctor or a specialist or something, that they can get help with these other things that are absolutely also affecting their pelvic floor. Like if we just talk about a hypermobility issue or like a connective tissue disorder, so those would be, one is actually called hypermobility syndrome, and another one is called Ehlers-Danlos syndrome. And those, if you have connective tissue that's not doing its job, it's supposed to like hold your joints together, and also it makes up like ligaments that hold organs in place, and it's literally affects every system of your body. Like that's just one example. But if you think that those ligaments are not doing their job, and then your muscles have to work harder in order to like take up the slack, I guess, um, that that also can happen in your pelvic floor. So people who have um, neurodivergence are, like I said, are more likely to have this like connective tissue issue, and they're more likely to have pelvic floor muscle tension that's causing them pain. Um, and I could just treat that without talking about the connective tissue issue, but then I wouldn't be doing those people like justice. They need this information so they can say, okay, I'm going to modify how I do this activity based on what's happening in my pelvic floor and what's happening with my connective tissue. There are certain like ways you can exercise that can help like mitigate any issues that you can have due to these connective tissue issues. So there's a whole lot of like things that you can think about that people can really improve their lives if they just have knowledge. So yeah, I should send you this article. It's called The Connectivome Theory, and it's short. It's not like a terrible, like long research article, but it connects all of these things. It connects neurodivergence and GI issues and POTS and hypermobility issues to a connective tissue disorder. So anyway, anyone out there, if you just Google the connectivome theory, this article will pop up.
Yeah, and if you can send that to me, I'll link it in the comment or in the show notes as well, because I think the more information and resources we can get out there, the better as
Yeah,
well.
absolutely.
Hearing you talk about this, it's striking me that trans and non-binary people, oftentimes when our health is talked about, it's talked about in the context of sexual health, sometimes reproductive health and mental health, but very rarely is physical therapy talked about, connective tissue disorders, anything that you're treating, that you're working on. So what it really, like, what led you to develop a special interest in physical therapy at the intersection of supporting trans and non-binary people?
Yeah, I think that it probably was like somewhat selfish actually on my part. Um, I have been doing pelvic floor physical therapy since I, graduated from PT school. So, that's been a long time, but it's not always been me, really wanting to like help trans, non-binary, intersex, like gender expansive people like I do now. And I am pretty sure it's because I was like in the midst of like realizing that I'm non-binary, and my brain just like obsessively like latched onto this like idea that I have to like delve into like helping this specific group of people. And I think it was born out of that it was just a part of my process and coming into my own queerness. And it's like my brain was like a bulldog. It just latched on, and I obsessed about it for a while. This is also the neurodivergence too. It's all connected. Yeah.
Would you say that the work that you're doing through Aero Physical Therapy and focusing on these specific groups is pretty unique in the field of physical therapy?
It is. It's definitely like a specialty of a specialty for sure. We're very lucky right now, I think, to be in this time where we actually have like a good number of just pelvic floor physical therapists, like especially if we're talking about Phoenix. We're a large city and we have a good number of them, as opposed to like when I started, like what, I don't know, 12, 13 years ago. There was like just a handful of us. So we've really grown a lot. I'm not sure what the number is now, but it's probably like in the mid 20s. So it's a good number. It's still probably not, what we need, but you can get the care you need, for the most part. You can find someone who's like relatively close to you. But then when you add on this, working with, queer people, not everyone is competent in that. Now, most people, have a pelvic floor. And so you absolutely can get like competent, physical therapy for your pelvic floor, but having a physical therapist who knows history, knows, like cultural things, knows about the procedures that people go through, knows that not everyone wants to talk about their body parts in like a super anatomical way that we're taught to. That is something that's unique. And I happen to know multiple pelvic floor physical therapy therapists that are like me, but it's because you just find each other. So that's, so I know other people who are doing what I do. Actually, I said multiple, but I lied. I only know one.
I mean, you and the other person.
Yeah. So me and one other person are like in this like subspecialty of a specialty. And then I know other physical therapists who also just don't do pelvic health, but they treat queer people and are super competent in that.
Yeah, this actually leads into my next question for you, which is, could you share some examples of specific ways that your treatments or the way that you run your practice is tailored to meet the unique needs of the gender expansive community?
Mm-hmm. In some ways, I do things that are like really specific for gender expansive people, but in other ways, I don't. I mean, really, I treat people the way that I would want to be treated and that I think everyone should be treated. So, asking people what they want to be called, and making sure that people like feel comfortable in my space. These are things that I do for everyone. And I guess it's different because I have like extra knowledge because I'm in the community, that it makes me more sensitive to, what queer people's needs are. But and then the more specific things that I do would be like, if someone talks about their body in a certain way and they use certain language, I mirror that language, and I'll just reflect back to them, how they talk about themselves, because that's what you do to make people feel comfortable. Um, but I think that probably one of the biggest things is knowing the different procedures, knowing how you heal from those procedures, and being able to, like, just being competent in that, like, that's a really big part of it. And then just treating people like human beings and like caring, and I'm sure I make mistakes, and then you just correct yourself and move on, and that's all you can do. So like I said, I think it's different, but it's not.
Yeah, I really appreciate you highlighting the fact that that you've really standardized care
Mm-hmm.
amongst all of the folks that you serve, to really put folks at ease. Because I think a lot of times when providers think of serving trans and non-binary people, and this has been my experience in training providers, is there's this perception of, eh, in order to serve trans and non-binary people, we have to be a specialist, or we have to treat trans and non-binary people in a way that's different than we would treat other patients or clients. And so I really appreciate your perspectives on this. And I would love to hear a little bit about how you help to create a comfortable environment for clients who are coming in to get a service that can feel so intimate.
Mm-hmm. So, well, first of all, I'm doing almost all my appointments in people's homes. So I take all my stuff with me. I have a treatment table, and I have a bag that I stuff full of everything I need. And um, I think that it taking place in their home, because it is like a super intimate treatment, that it helps a lot of people feel really comfortable. Um, and then I have worked in clinic spaces where I, was trying to do the work that I am doing right now. And I made really specific choices about what I had in the rooms, and, what things are out for people to see. So, like, if we're thinking about like what a clinic space could look like, then I choose like multiple ways to light the room, because neurodivergence. And also, people with chronic pelvic pain tend to also get migraines, so you just don't want like really harsh overhead lighting, or at least you need the option to turn it off. So I have multiple lamps around the room. And then I have my books. Like books are a huge deal too. I don't know if other physical therapists are like this, but like I love having my reference books. And I have one that's on gender affirming surgeries, and I make sure that that's out. And I have, another book on just like different types of identities people can have. And so I have these things out. I also, when I used to have a clinic space, I had pictures of my family, because people end up, you develop a relationship with people. I see people over like, multiple visits, and you just, when you're spending an hour and you're in this like shared intimate space, I think that people have to know who I am. And, you know, I think that's a part, also kind of a part of what I do. And I think why people feel comfortable. So it's not just the like physicality of the space. It's the space that you create.
Could you, well, I thank you. I really appreciate that. This has my mind just going into a million different directions. I'm curious and it doesn't need to necessarily just be interpersonal, but what challenges have you encountered while working in physical therapy with trans and gender diverse patients? And how have you worked to address some of those challenges so that we can still get what we need?
Hmm. This one's a little bit harder for me to answer. I think, I think that there's still not enough information. There's not enough research. There's not like, if we talk about like, some of the surgical recoveries that I help people with, I actually just had a conversation with the other physical therapist who's a friend of mine, um, about how there is this expectation that after you have like a vaginoplasty, that you dilate, a certain number of times a day and for this much time. And what we see as, clinicians is that sometimes people have, it requires so much for people to prepare to dilate, like mentally and emotionally, because it's painful. And then the act is painful. And then they need hours to recover because it's painful and it was emotionally draining. And they have to do it multiple times a day, depending on like how far out you are from surgery. And that kind of burden, um, is really a big one to bear. And that's just the emotional component or the psychological component. The physical component is also difficult, because you are recovering from the surgery and it's painful. And then your pelvic floor muscles might tense up and make it more painful. And then your pelvic floor needs that chance to relax, but then you psychologically know that you're going to dilate again, whether it's that day or the next day. And the stress of it causes increased pelvic floor muscle tension also. So I do feel like that's difficult, especially when there is kind of like a lack of research on like what do people actually need to do? Like, could we decrease the amount of times that people dilate, and still maintain the kind of like depth that people want, that they had in their surgery? And I can't answer those questions. And I can't make people's lives better if I don't have that information, because I could at least say, well, if you want to maintain, this surgical outcome, then you can, push through, and they could make educated decisions about what they want their outcomes to be and what they're willing to tolerate in order to get those outcomes.
Mhm.
And that information is just it's not readily available. Yeah. So that's very frustrating for me. Um, yeah.
It sounds like, it sounds like you have another colleague in the field that you're able to at least have some of the conversations around. Is that kind of how you've been navigating these spaces with clients and with this lack of research that currently exists around physical therapy?
So that is one way. And there are actual courses out there, and so I have taken some of those courses. Um, but having someone else to like discuss, these kinds of issues with, to bounce ideas off of. There's also like groups on social media where like there is a group that is called like a trans non-binary intersex, like pelvic health discussion group that I'm a part of. And so to have access to people who maybe have differing experience and hopefully more experience than I do, because you always want those people out there to be your mentors. So those are some ways. And then the other way to navigate it is that because everyone has bodies, and the stuff I learned in PT school and learned in training to become a pelvic floor physical therapist, I can apply that knowledge to every single person. Like, it doesn't matter if you're trans or you're intersex or not. Um, so I think just applying knowledge that I already have and just tailoring it to the person. And kind of going back to that, like, oh, well, it's not that different treating, gender expansive people like it is, but it isn't. It's taking that information that you already have. And I would do this for every single person. I treat the person in front of me, you know, and I don't need necessarily, you need some specialized knowledge, but I don't need anything beyond, just the knowledge about like, how do you just, I don't know, just tailor things to an individual. Yeah.
Yeah. So the work that you're doing it sounds like can be incredibly intimate, and there's a lot of forethought that goes into that, creating a space that's going to feel safe, creating a space where folks are able to almost like before care and after care, the session as well. And I'm wondering, how do you approach discussions around body dysphoria as part of doing pelvic floor work, but also physical therapy in general with trans and non-binary people?
Mhm. Yeah, for those type of discussions, I let people like come to me with them. I don't initiate those discussions ever. Um, if people have something that they want to talk about in our therapy session, then I'm available for it. But don't. Um, I really try to refrain from like giving advice or doing anything beyond just like listening. Um, I'm not a mental health provider, um, but sometimes you still have to navigate these things that like can be difficult subjects. Um, I think that for the most part, I just try to just be present and to sit with people through things. Um, I think that's probably people need that, just as much as anything else anyway, and maybe more. I think I need it a lot. So,
I mean, same. And I could see how, as you mentioned at the beginning, like these decreasing rate times, the urgency to move through many patients in the same day in quick succession, how it would really start to eat away at that ability to develop that interpersonal rapport with folks around and provide that space when and if they do need that space as well.
mhm. Yeah, I absolutely have had appointments where I have not even touched someone, and we sit there and talk. And when I had those appointments in like a clinic setting where, I worked for a company, um, I can't bill for that time unless we actually talked about their care. And there have been times where I have not, but then that time was like in the corporation's mind, that time was wasted.
Mhm.
But in my mind, what I just did with them was probably just as important as any physical thing that we did, because um, if I hadn't allowed for it to happen, the physical therapy session would not have been successful, I don't think. I mean, you don't know the future, right? But people really do. I don't know. I know that my patients talk about this, which is you go into a doctor's office, like your primary care doctor, and they have like 5 minutes to listen to what you have to say, and they interrupt you and they, give you a prescription or they refer you somewhere else, and you're done. And I'm really fortunate to be able to have like these types of conversations with people, um, because I know that they need it. And I still get to like help them access the care that they need. Like I have a resource list of like people that I recommend of like different, doctors and specialists, different types of providers. Um, so I still get to do that, but I get to talk to people too. So,
Yeah. So there are kind of two audiences that sometimes listen in on Ask Miss Jai Live. And I get folks who are trans and gender diverse across the gender spectrum who are non-health providers. And then I get folks across the gender spectrum, but predominantly cisgender people who are health providers. And so I have two kind of back-to-back but very similar questions for you. The first is, what do you want trans and gender diverse people who are listening to know about their pelvic floor health?
hmm. So I don't know that this is like super specific to just, gender diverse people. Um, but I think that one of the most important things you can do is to improve your awareness of your pelvic floor. Um, because if you have some sense of like, I can tell when I can contract those muscles, like I can feel that happening, and then I can feel it letting go. And then I also can lengthen my pelvic floor. So that's that kind of feeling of like bearing down, like when you might push to have a bowel movement. And then I can feel that happen. And then I can feel those muscles return to their previous resting state. Having that awareness of your pelvic floor, um, like will serve you so well, because you'll be able to know when things are not working,
Mhm.
and then you'll know when you need to seek care. There are a lot of times where people don't necessarily know that it's their pelvic floor, or maybe they have like chronic back pain and they've gone to doctor after doctor, they've gone to physical therapy, and maybe it helped a little bit, but nothing really helped. And then they come to someone like me and discover it wasn't their back. It was their pelvic floor referring pain to their back. And so if you have access to that knowledge of like what your muscles are capable of doing, and then you can sense when those movements are happening, then when they are not happening, you can say, oh, there's, something's up. And now I know that there's something I can, like someone I can see to get more information so that I can do something to make my life better.
Yeah. And what do you want other healthcare providers to know about, and this could be physical therapists or just healthcare providers in generally, to know about serving the gender expansive community and pelvic floor health?
I would say that I would like other providers to know like the breadth of what we can do for people as pelvic floor physical therapists. I think that the people who come see me now, of course, I'm drawing on like my experience with patients who it's like its own like subset of patients, right? So this is not going to be like, maybe, I don't know if it's generalizable or not. But give me a second. Ask me the question one more time because my brain went and then it went.
What do you want other healthcare providers to know about pelvic floor health and serving the gender expansive community?
Okay. So I would love them to know like the breadth of what we could do, because I know that a lot of people come in, they end up in pelvic floor physical therapy, but not because their provider recommended that they go. They heard about it from a friend or something. And so their providers are not necessarily knowing what we can do to help people. And so then they're not referring people to us. So thinking about, a lot of people think, oh, you had a baby, you can go see a pelvic floor physical therapist after having a baby, right? And it's absolutely, I think that's a fantastic idea. I think that everyone should, before delivery, have at least one appointment with a pelvic floor physical therapist, and then at least one after delivery. But that's not all we do. I mean, we help people who have urinary leakage. We have people who have urinary like frequency, like going too much, or like having the urge to go like too often, and it's like super strong. We can help people with fecal leaking. I can help people with prolapse issues. That could be, like a front canal prolapse. That could be a back canal prolapse. And there's even like some specific like subsets of people who maybe want to experience a prolapse. Like in the queer community, sometimes that's a kink, right? But then they might also have some like maybe fecal leakage, like that accompanies the fact that like they have this ability to prolapse. That you don't have to lose the ability to prolapse, and you can also fix the leaking, but you got to come see me. So for people who have these issues, like I want them to know that there's help, and you can still have a really like functioning pelvic floor, and still like enjoy your body and enjoy the activities that you want to do with it. And then to speak a little bit more on like all the things that we can do, well, there's like tons of pelvic pain disorders that we treat, and anything that causes pain in the abdomen or pelvic area, to just send them to a pelvic floor physical therapist. Like there's so much that we can do to help people. And it's totally life-changing. People just don't know. You would think that like all gynecologists and all GI doctors that they would know, or all prostate doctors that they would know, that were available and out here, but really they don't. And that's really kind of unfortunate. Urologists, same thing. Many of them don't refer out to pelvic floor physical therapy, and we could really create this kind of like multidisciplinary team, to help people get better if they, if they had more knowledge about what we do.
Yeah. How can folks connect with you? How do they connect with your practice for therapy, for physical therapy? How do they connect with you around these dance classes? How can folks connect with you?
Yeah, so I do have my website. You can email me. My email address is listed on the website. There's also a contact form. I'm on Instagram. I'm on TikTok. So I can give you my handles for that. And then you can also find me through Newbox. So I sometimes teach classes out of Newbox, and you can, like, my email address is also like on the Newbox website. So those are like absolutely ways that you can reach me. And if you're curious about any like pelvic health issues that you might have, or preparing for surgery or recovering from surgery, whatever the issue may be, that I do like free consultations. We can do like a virtual meeting kind of like this, and just talk about your issues, and then you can decide, how you want to move forward.
Awesome. And we will have all of that contact information, those websites, all of those links will be down in the show notes as part of this so that folks can connect up with you and learn more about the work that you're doing, but also connect with you to get their health needs met or take a dance class with you as well. Before we go, I have one more final wrap up question, but is there anything that you'd like to promote, anything upcoming that you'd like folks to know about?
I'm performing in a dance performance on September 2nd. It's going to be at the 3rd Street Theater at Phoenix Center for the Arts. So that's downtown Phoenix. The show is called New Work, but it's spelled N-U-E, work. And it's the permanent artists in residence with Newbox. And then some previous like residency artists that we've hosted in the past are presenting their work. And so I have a really beautiful piece that I'm dancing there. So I'm super excited about that. I also just, Ms. Jayu posted about it. I just got a grant from the Trans Justice Funding Project. Yes, I'm so excited. And I'm working with the other physical therapist that I've been talking about. By the way, I'm going to say her name is Rebecca Patton, and she has Patton Pelvic Health, and she's a phenomenal physical therapist too. So we got together and we created Phoenix Trans PT. And so there is like a link to that on my webpage, or a tab for that, so you can get some more information about it. And we are like gearing up to start giving like low cost visits to trans, non-binary, intersex, gender expansive people. And I'm just really excited to be doing that.
That is so amazing, Sam. I'm so excited that this is happening in the community, and thank you for the time and energy and effort to apply for that and make that a reality in our community.
Well, thank you, because I didn't even know about that grant until you told me about it. So, and I put on my calendar, I was like, as soon as that grant opens, I'm applying.
See, we're out here, people helping people.
Right.
Well, my final question, and I ask every guest this, and it could be as specific or general as you'd like to respond, but what brings you joy?
I would say that in the past like few years of me, like, realizing more things about myself, and just, coming into my queerness, starting my business, realizing like my neurodivergence, like all of these things have really helped me feel like better about myself, but also like find community of like other people who are like similar in so many ways, and also dissimilar, which is, cool. But I really had a hard time, I think, especially like earlier in life, like finding some sense of community. And I have really found that now. And I think that gives me a lot of joy. Just to be in community with you, and with Rebecca, and to be excited about, you know, what we do and what we talk about, and be happy for each other. Like that's the best.
Yeah, thank you so much. And thank you so much for being on Ask Miss J Live. I really appreciate your time and your energy. And for those who are checking this out, let us know in the comments what you enjoyed about today's discussion, other questions that you have. Please connect up with Sam and with Aero Physical Therapy, and take a dance class and learn more about your own pelvic health, because we are deserving of health and well-being. So thank you, Sam, for being here. And for everyone listening at home, thank you for taking the time to invest in the health and well-being of trans and non-binary people. Until next time, stay safe.